we have reached a pivot point. How well we pivot is on us, all of us. And so if you ask me, will things go well, I'll return the answer by saying, will everyone do their part? And if everyone does their part, then yes. If not, get ready, because this thing has taken us on a wild ride. COVID is hard to tame, and we've learned COVID can throw any number of things at us. So get ready. Why do I need to wear a safety belt in the car? Today, you take it for granted. 98% of Americans, I believe. We have a good sense of COVID, at least the variants that we've seen. We know what we can do. We've got not just vaccines, but treatments that we know are effective. And so, as CDC has told us, we can go back to doing things like normal if we take precautions. The scientists have communicated pretty directly with the American people what to do. Sometimes some aren't willing to listen to the message. More often, unfortunately, somebody else decides to slant or skew the message or completely destroy it in ways that are untrue. And it's that disinformation, that misinformation that we're fighting right now. More than 255 million Americans have fully vaccinated. We have delivered into arms more than 550 million total vaccines. We still have to get to the under 5 years of age. We still have to do more for those Americans who got vaccinated but may have cancer, therefore are undergoing chemotherapy, therefore have immunocompromised systems and therefore need more protection. But the scientists have given us a roadmap.
This swab takes about 15 minutes for it to run, okay? And I'll come back and let you in, all right? Thank you.
Congress did not provide us with some additional funding the way it had a year ago to address COVID, and what we've communicated to Congress and now communicating to the world is the resources that we have to address COVID so that you don't have to pay a single cent to get that vaccine. You didn't have to pay a cent to order from the government those tests. You didn't have to pay a cent to order from the government those masks. We're running out of the resources to do that. And unless we have the dollars, we can't go from hundreds of pharmacies that are offering test to treat to the tens of thousands that can do it.
What would you tell, like, say, a niece who had young children in school about masking, unmasking in these times?
I'd say to my niece, do you love your child? When your child gets in someone else's vehicle, do you make sure that your child is buckled up? Do you make sure that if your child's going to be out at night, that there's a way to check on them, find out where they are, make sure they get home safe? If your child's going to be in a school where there may be cases of COVID, what are you going to do? It's the same thing. It's just a matter of being responsible. We know what we have to do. There's no law against masking if you're a child or asking as a parent for your child to mask. And I would hope that there's no stigmatization of a child if a parent says, I want my child to wear a mask.